Tēnā koutou katoa and welcome to eHealthTALK NZ. I'm Rebecca Macbeth, I'm the media editor at HINS, and today I'm joined by Bindi Norwell, who's the CEO at ProCare. So welcome on the show, Bindi, lovely to have you. Can you just start by telling our listeners a little about yourself and your background?
Sure, kia ora koutou, and it's great to be on the podcast, so thanks for having me. As the CEO of ProCare, we are around primary care. We're the largest primary care organisation in New Zealand. We are here to keep people well and out of hospital. So a variety of things such as we support around 150 general practices. We have the largest virtual health service with Care HQ and Whakarongaro, the National Telehealth Service, and Fresh Minds, a mental health and wellbeing service. So quite a variety of things in health, but really primarily about keeping people out of hospital. And I've been here in the role about 5 years now, and it feels a lot longer. We've been through all sorts of things in the health sector over those few years, but it's been great, and I'm really looking forward to sharing a few insights on particularly AI and data, what we're doing in that space.
Great. And so you received the Innovation Leadership Award at the New Zealand Leadership Awards in 2025. Can you just tell us, what does leading innovation in primary care look like for you day to day?
Yeah, I was really honoured to receive the award. It was great that it was recognised, some of the work that we're doing in primary care. And, we have huge challenges and opportunities to support people in the primary care space. And, there's absolutely right for innovation and doing things differently. And to give you an example, we have quite a few challenges, like with, not enough workforce to keep up with the demands of healthcare. We have an aging population. We have the ability to make a difference through leveraging AI to reduce administration, speed up efficiency, may have a better patient experience, use it for predictive analytics and health. And so we felt it's a massive opportunity across not only Auckland, but the rest of the country with innovation in the space. So, we've really made it front and centre for a lot of the practices we do. And it's about embracing innovation. It's about providing a safe space for people to play with it with guidelines. But the key is really understanding the problems we're trying to solve here. And that's, a big part of our mantra is, well, what are the things we're trying to solve? What are the best ways that we can actually address them through innovation, trial things, and then it's about test and scale model as well, because if it works in some parts of the country, why wouldn't it work across the entire country? So, that's been a big mantra of ours in primary care.
What does innovation actually mean to you? Because it's not always technology, is it? Sometimes it could be around a changing model of care or something along those lines.
Yeah, I think it's going back to the problems we're trying to solve. We have challenges such as, an aging population. We've got not enough workforce to keep up with the demands. We have very clear problems that we want to solve. And so innovation is around understanding that and then thinking outside the box. Is there a better way of doing things? Are there sort of solutions that we can bring to the market that can help solve those problems? And it's really about testing and being open to new ways of doing things. And then also really co-creating. I think that's really important, as working with clinicians to think up new solutions and innovate. And a big part of it is listening. And you might not get it right the first time. It's about a reiterative process that you can improve it all the time and continue to innovate. It's not just, you've put a new thing in and move on. It's actually, well, how do you keep that journey going to continuously have that innovation mindset? So it's very much, innovation to me is a cultural shift as well. It's a mindset shift. It's about our team and the people we're working with embracing it and being open to do things differently. And then lastly, it's about celebrating the success. So the proof points, the outcomes that come out of innovation. It's about really being clear on those benefits and those outcomes, but celebrating some of the wins. Failing fast, lastly, is some things don't work, and we know that it's really important to stop them if they're not. And that's okay. It's that fail fast approach with innovation too.
As you've already articulated, primary care is under significant pressure in Aotearoa. So what are the biggest challenges you're trying to solve through innovation at ProCare at the moment?
Yeah, I think that a lot of them are some of the day-to-day things that clinicians are dealing with. And, we've got a workforce that's very much under pressure at the moment. And when we get under the hood of that, you really understand how much time is sucked into administration. And those things that technology and AI is a perfect enabler to reduce that administration. So, for example, if you go and see a doctor, they need to transcribe all of the information that, your conversation, to make sure it's all documented, that it's clear on any recommendations from a clinical perspective. Now, that takes time. And if that can be done through AI, which we're doing now with Heidi Health, that reduces a huge amount of administration for doctors so they can spend time with their patient. So I think there are so many opportunities to look at those pain points. I think moving ahead, getting into the space of preventative care, when you're sitting on large data sets, anonymized data sets, how do we actually get into predictive analytics? And there's some really smart things that are starting to happen or are happening globally in that space. You can predict population health issues before they even happen using data, and also looking at things such as MRI scans. How does you use technology to really speed up efficiency? So I think there's a variety of different ways we can use it, but it's really understanding those pain points in primary care, workforce challenges, a lot of administration. We want more time spent with patients.
So when you do introduce new technologies into these healthcare settings, what leadership lessons have you learned about bringing clinicians, your practices, and even patients along on that journey with you?
A lot of it's habitual change as well. So, I think that when you're busy in a practice or you're a clinician, whether at a hospital or a GP practice or wherever, really, you get very, you're busy. You're on your, you're always on to the next task. And so for me, the leadership is around not only having that innovation mindset and culture of doing things differently, but helping when you do have those technologies or the solutions, that you bring people on the journey and help them make it habitual. And that, sometimes you've got to turn on a machine or an AI or something else. You've got to change the way you actually work. And so you need to make it habitual for uptake. And that's working with clinicians to help not only make it habitual, but also understand any barriers that you've got to make things integrated. You've got to make things as easy as possible, and also make sure that they can understand the benefits of any change. So I think that's the biggest leadership. It's really that constant mantra of doing things differently, but making it easy to make the changes to adopt anything new.
Have you had any surprising lessons around adoption? I know sometimes people think, for example, if it's a technology that involves patients, that older patients might not adopt quickly, but they've found, in fact, that they're actually pretty keen, or with your clinicians where you thought, oh, I wasn't expecting that, and it's quite an interesting lesson to share.
I think that, what was interesting, some of the technology we've implemented, some clinicians love it, but then they go, oh, damn, I forgot to turn it on. And, that pain point of just forgetting sometimes. And I think that's, very easy to do. So, I think that, like, as I said before, you have to make it very habitual, and anyway, just have a Post-it note on your computer to make sure you turn things on, or making sure that becomes a habit. Just to your point on the older population as well, they're really great with technology too. So, for example, with some of the technology, it means that their doctor can, spend more time with them and really not have to rush things. That makes a big difference for people. And so when they realize it's technology that's helping that, they're way more open to that because they can see an actual benefit to them on a day-to-day basis as well.
You've also helped to launch Health Accelerator, and that's going to fast track some of these digital solutions in primary care. What problem were you looking to solve when you developed this, and can you just tell us a bit about it?
Yeah, I think it's super exciting, and it's just the start of it, really. So we realized that in health across the country and globally, we have a lot of common problems or opportunities to improve the system and a better patient experience. And what typically can happen in healthcare is that we work in silos, and what we wanted to do is create a collaboration that addresses common issues and opportunities together to get a test and scale model for New Zealand. And so instead of doing things alone, we thought we partnered with the 4 largest primary care organisations in New Zealand to test new technology or adopt new technology, AI and solutions, and do it in a way that can scale it on a national basis. Because what we've realised is New Zealand is, we're a small country, stronger together a lot of the time. And to make New Zealand attractive for international organizations and solutions, we really wanted to have a way of giving scale. And so instead of having 145 practices that we can support, we're looking at 500 and 2.5 million patients. And so it gave us a level of scale that is attractive for procurement deals, but also to get that scale. So yeah, we're working with some partners from Australia or from international partners and also in New Zealand to go, what are the solutions that we can bring? But you have access now to a national solution. And so that's worked really well with Health Accelerator. So with that partnership, we have an innovation pipeline. We've got around 56 or 60 ideas. There's a lot of opportunities to sort of bring solutions into primary care, but we also are doing it on the smell of an early rag, and we need to pace, and we also need to do things well, and we can't do everything. So it's about how do we make choices on some of these, so that some of the innovations as well. But I think to date, it's working really, really well. And now it's how do we take it up a notch, get more resource, and make things move even faster for not only, regionally, but nationally. And even how do we collaborate between primary care and secondary care, to leverage the strengths in both of the areas to make even better experience for patients and, outcomes for countries. That's the next thing I really like to work on with it.
Yeah, that ability to scale is so important in healthcare, isn't it? Too many silos and pilots going on.
Yeah.
But from your perspective, where is AI already delivering real value in your space?
So we've got a very tangible an example. I think people are very aware of it at the moment with Heidi Health, and that's a transcription service that we partnered with. And an Australian organisation really well integrated into practices, but also hospitals now. If you've seen that Health New Zealand's adopted Heidi. Now that's AI solution that transcribes the conversation from the doctor and integrates it seamlessly into their PMS system or the system they're using. But it's getting more and more sophisticated. It can understand medical terminology really well. Teleo, it can actually now complete tasks on behalf of the GPs. And doctors, they own it at the end of the day, but it can go and do a referral. It can go and write a letter on if someone requires a medical certificate. It can do all sorts of things. And then it might do AI reception. It can start on, once it's integrated into practice, it can add on new services on top of that. So, I think that's one that's saving around 7 minutes per consultation. If you think a consultation with a doctor is around 15 minutes, that's a huge amount of time, not only with a GP or at practice, but across the country. And, we're playing with robotics and digital assistants. Some of those menial tasks, administration processes can all be done by robotics and, using AI. And I think that I would really love to see a bit more of the predictive analytics going forward. So you sit on population data sets, and if you can predict using AI, the prevalence of diabetes, for instance, in a certain area, we can sort of have intervention programs. So that's starting to happen as well.
Great. So can you just tell us more about when you do deploy tools like AI scribes? You talked about inbox assistants and robotic process automation. How do these technologies change the daily workflow for clinicians and practice teams? And what kind of feedback have you had from them about the impact they've had?
Yeah, I guess let's talk about the transcription. Once now that clinicians are really starting to adopt that technology, they're finding it really, really helpful. It just speeds up the efficiency, the administration that they can sometimes spend their evenings having to write up notes. Really, it just gives them more time back with their patient. It gives them more time back with their families. So they're going, wow, this is really game changing. And they know that ultimately they own the recommendation and their clinical view on everything that's in the system and with the patient, but it can help speed things up. So that, that's actually making a difference to their lives as well. It's making more the actual practices more efficient because you've got the increased level of data and the referrals into if there's actions that need to happen on the back of their consult. So to answer your question, it's making a big impact. And I think it's just the start as we add more and more processes that we can do in a clinic. An example again is with the robotics. So we have some clinics that they're just so busy. Sometimes they don't do the ACC claiming or another product claiming. And so this robot will go and find the claims that haven't been retained by the practice or had by the practice yet. And that can mean thousands and thousands and thousands of dollars. And when you have practices that it's tough in terms of a financial return, some of them are really struggling in terms of making sure that financially sustainable. So this can make a massive difference to not only their patient experience, but their bottom line and sustainability of the practice. So that stuff makes a huge difference and they can see that. We're getting more and more used to technology and AI. We're getting more comfortable with it. But I would say that the most important thing is that their patient data is protected. And say you think about what's happening in terms of some of the cyber security issues that have happened, that people just need assurance that patient data is protected and the systems are robust and that they're reviewed accordingly as well.
Yeah, as you mentioned, the security and privacy have become hot topics somewhat in 2026. So how do you ensure that trust in digital primary care systems? How do you ensure it remains high amongst both the health professionals and the public?
I think that it's just important that people do their due diligence on any kind of systems and tools. There's a lot of tools out there that are appealing to practices, and it's making sure that ultimately they do the checks. And what we try to do is help with the due diligence on products and solutions. But if, we also give the tools to be able to, what are the key questions that you need to ask as well? What are the things that are really important to make sure you have confidence that they've got secure processes in place? Privacy laws are understood, particularly that pertain to New Zealand as well, that are fit for purpose for New Zealand. So I think auditing, pushing back on vendors to show that they're demonstrating where they are protecting data, and it's just not a one-off process. This is something that should happen on an ongoing basis because things change so quickly. Technology is rapidly changing and fast-paced. We need to make sure that that's happening all of the time. And also Health New Zealand, I know, do a lot of reviews for products and services as well. And it's just that extra assurance that, they're fit for purpose. So it's very, very important. And then in terms of patients, I think it's communicating to patients, that the assurances around a certain product and solution that their data is really protected. And these are the things that this organization does to protect your data. And so to get wide adoption, it's the clinicians and their patients, like you say, that need to feel assured. But, things are happening quickly. And that's why we need to make sure we're looking at it regularly.
And having that scale when interacting with vendors must help as well in terms of having a slightly louder voice, perhaps, than, as you said, sort of a number of individual clinics. So how do you go about evaluating new tools before you implement them? Do you have a process in place? And how do you monitor that they're having the impact that you were hoping they would?
First and foremost, it's around clinical assurance. With any new adoption in any new technology, it needs to be clinically safe and sound. And so we have a clinical committee that would go through that, really understanding, what are the key outcomes? Are they safe to use? And looking at the privacy and security standards with that organization or that technology. And looking at equity, that's a really big thing as well, making sure that it's fit for purpose to understand the nuances of the New Zealand landscape in terms of our population, our Māori Pacific population. Has it got the right data makeup for that as well? And does it really fit with existing workflows Do we need to have a change management process to make it more highly adopted? We would go through a number of steps as part of that innovation process, the assessment, right through to implementation, and then understanding the outcomes. If it's, what is it delivering? What are the patient benefits? What are the efficiency benefits? To then, one, can it be improved, or is it getting the best return on investment, with that technology or AI solution? So yeah, it's probably right through the process. And I think working with the partners themselves is really key, because you can co-create. They're always typically open to changing things to make sure it's more fit for purpose as well. And working with those that have the resource on the ground to help educate, to train, and make sure that, that you're getting the best out of any solutions as well.
Absolutely, yeah. That partnership approach is the best way to set out on these journeys, isn't it? So if you're looking ahead, say 5, 10 years even, how do you see technology reshaping primary care in Aotearoa?
Yeah, I'm so excited by it, and I think a lot of people are. And I think we need to be, obviously, with a cautious mentality as well, that we've gone through the right processes to make sure things are safe. Because, as I said before, things are happening really quickly. There's a lot of shiny toys out there in terms of solutions. So I think let's innovate, open to new ideas. I'd love to see more partnerships globally and learning from what other countries are doing and sharing those kind of experiences. I love the fact that a lot of international organizations see New Zealand as a great test bed for innovation, because we are a smaller country. We're more open, a lot of times we're quite open to innovation, but also can get things done. We can call up people, we can make changes where needed to get things readily adopted and changed as well. So, but I can see more moving into that preventative space. So we can look at the challenges and address some of the administration, the efficiencies, the burdens, and improving that. But I do feel, with the wearables that people are using, the data that's available in our population health, we have, I think we have a huge, exciting future ahead if we can look at that and use it to drive big changes, the way we live, what we eat, the way we look after our health, empowering people with their own health data so they have more visibility of the things that they need to do to keep well. That's really exciting, I think. And I think that's, it's quite a big journey with that, because it will take not only the technology, it's understanding the data and having sovereign data as well in New Zealand for AI, but also then, taking people on that journey, our population on, really helping them with their own health. And so, yeah, that's primary care. We want to keep people well and save the country money by not going to hospital is the key.
I agree. It certainly is an exciting future. But we're going to have to wrap it up there. Thank you so much for joining me today, Bindi. And to our listeners, be sure to like and subscribe to this podcast to make it easier for others to find. Mā te wā.